So remember the one thing I told you, I do lectures for my med students every single week. The first lecture I give them is a shoulder lecture. We go through, do a shoulder exam. The first thing I always tell them is make sure you're doing a shoulder and a neck exam. So what we'll start off with, I'm actually gonna have you turn this way. So I'm gonna start by doing a shoulder exam. So go ahead and lift your shoulders all the way up. Good, so we're checking range of motion. You're gonna bring them back like this. Good. Put your arms at your side, rotate them out. And then you're gonna try and bring them up your back. Now she looks like she's got good motion everywhere. So I don't see any restriction in either one of her shoulders. Did you feel pain doing any of that?
Yeah, the back.
Feel it, so you go back, okay. Yeah. So then I'm gonna come around and I'm gonna feel up here, her trapezius are tight, which I assume with most med students because they study all the time. And then I'm gonna kind of feel down her neck, but best way to assess, laying down. So go ahead and lay on your back for me. Doing that motion, did you feel it in one shoulder more than the other?
Yeah.
Which one?
Right.
Okay. So I'm going to start by checking her range of motion. That is good rotation. Okay. And a side bend. And we're in a side bend. And there's a little bit of restriction right here, which is not the side she's feeling, but that doesn't mean it's not contributing. So then I'm going to go through and do translation, which is where I'm on the transverse process, and I'm literally just pushing back and forth with my fingers. So when you see what I'm doing and I'm telling you I'm translating,
yeah.
Right here and here, see how I'm pushing? You feel that?
Yeah.
So I'm literally just pushing. And so you definitely have some restriction right here, kind of at C2 and C3.
Yeah.
Okay, so what I'm going to do is I'm going to put my thumb on that spot, and then I'm going to check and see where your restriction point is. It should be right about here. So I can't take you past this because it would hurt you to go past this.
Mm-hmm.
So now I'm going to have you try and activate, and you're going to push to your left. And you feel that?
Yeah.
Good. And relax. And then I'm going to take up this slack and push again. Good. And relax. One more time. Good. Put her back in neutral. That feels substantially better. So I still feel a little spot that's stuck just right here. Lay on this side for me. So I'm going to check, put this arm straight down. Good. So I'm going to check rotation going this way. She's a little bit stuck here. So we're going to try and rotate. This is just a different way to get a good rotation of the neck. Turn your head to the left and stop. Good. And we just pop open that one cervical vertebrae, which is what I was just trying to do. So have you ever had chiropractic before?
I have, yeah.
So does this feel totally different than chiropractic to you? Go lay on your back for me. How does it feel different?
I feel like you're activating the muscles more.
Okay. It's a little bit more controlled is typically what I hear. Mm-hmm. So we're going to go back and look at her shoulder. So I'm going to look at her external rotation, which is fantastic. But she was having pain in this, and it looks like her internal might be a little bit stuck. Do you remember what muscle is responsible for internal rotation?
Interesting.
Subscapularis. So the only way to get to her subscapularis is to go through her armpit. So, and this, have you seen me do this yet?
No.
Okay, this hurts more than anything you're going to see.
I've seen you do this before.
So I have to get to the muscle belly. So I'm going to go in and push in here. And we literally go around. And so I am trying to get that muscle to relax. Good. And I can feel a little clicking sensation when I'm doing this. And a lot of the times that's just a tendon rolling over. So it just means she has an inflamed tendon. She can feel the clicking too.
Mm-hmm.
So we're just trying to get it to relax. She's gritting her teeth. There we go, that's getting better. So we're gonna come. You feel that difference?
Yeah.
Good, go ahead and sit up for me. Now I want you to move your neck around, left to right. And then you're gonna try and do that motion behind again. How's that feel now?
Yeah, a lot better.
Good. Good. That's the goal. So that's a little bit of what like manipulations feel like, so you know, because it's by feel to learn to know how to do it as much. So like that's why I'm good at it because I do it so much. I see like 6 patients a day sometimes doing this when I'm not 8 months pregnant. Okay. We are all done.